Opioid drug overdoses killed more people in Colorado than car crashes in 2014, and it was right around that time that the state passed a new law meant to crack down on the abuse of prescription painkillers, which was behind the majority of those overdoses. So, a few years on now, is Colorado's crackdown on opioids working? Brandon Ritteman and our Verify team take a look.
We'd always like to give you a clean-cut yes or no when we verify things, but it turns out opioids are a tricky problem. This is going to sound like a paradox, but two things are true. We verified that the new state law is helping, but we also verified opioid overdose deaths continue to break records in Colorado. How can those both be true? Well, the new state law took on a big problem, doctor shopping, which simply means going to a bunch of different doctors trying to score painkillers. Used to be, if you asked the doctors about this,
they think, well, my patients aren't the doctor shoppers. I would know who would be a doctor shopper, and they have learned over the years that you really can't tell.
Dr. Robert Valek is a professor of pharmacy at CU and president of the State Prescription Drug Abuse Task Force, where he's been a member for 19 years.
There is no profile of a person who might be a doctor shopper. It could be anyone, young or old, male or female, any race, any gender.
The state tried tracking this problem with a computer system, the Prescription Drug Monitoring Program. It was voluntary. Only 30% of doctors used it. So the state changed the law in 2013. They required pharmacies to use the system. They didn't make doctors use it, but they did make the doctors at least sign up for an account if they prescribed controlled substances. Some doctors complained that the system took up too much of their time, so the new law also allowed doctors' office workers to log on. That 30% shot up to 91% in 2015 as a result. And the data shows doctors actually started using it. At first, they flagged a bunch of potential doctor shoppers, and then a lot fewer as people realized it was hard to get away with anymore. And you can see the effect it's had on this chart of prescription opioid deaths. The number of deaths went down 2 years in a row. That's never happened before in the last 17 years. So it's working. Case closed, right? Not exactly. Users are finding another place to get the same fix. Heroin dealers. We've shown you the footage of people selling and using on the Cherry Creek bike path. Denver's district attorney says she sees more people dealing heroin because addicts still want opioids, legal or not.
If they can't get that prescription, if they're still really addicted, then they switch to heroin. And heroin is cheaper, you know, it's available on the street.
That's extra frustrating for DA Beth McCann because she sponsored the bill to crack down on doctor shopping back when she was in the state legislature. She's proud to see these numbers go down, but it's hard to celebrate that when heroin deaths are way up all of a sudden. In the past year, prescription opioid deaths went down 9%, but heroin deaths are up 43% in Colorado, undoing the progress made on this disease.
That's been an unintended consequence, if you will, of the reduction in opioids prescriptions.
So we verified what's happening. Yes, the state law is working on one battle, but we're still losing the war against the opioid epidemic. They fixed an easier problem. Pharmacies are going to obey the law. Heroin dealers, not so much. Still, there are some things to try next. Doctors are starting to prescribe fewer pills for things like minor surgery, because those leftover pills are how a lot of addicts get started. And we're seeing more places keep a supply of Narcan, which can easily save someone from dying during an overdose. If there's a cure to this disease in our society, we haven't found it. But we have found some ways to make a dent. Here to verify, I'm Brandon Ritteman.
We invite you to check our sources and to go in depth on the opioid problem in this article on 9news.com.